Rheumatoid arthritis, commonly referred to as RA. Systems involved. In autoimmune disorder, rheumatoid arthritis occurs when your immune system mistakenly attacks your own body's tissues, mainly shown in joints. Can damage a wide variety of body systems, including the skin, eyes, lungs, heart, kidneys, salivary glands, nerve tissues, bone marrow, and blood vessels. Symptoms. General. The joints most often affected by RA are in the hands, wrists, feet, ankles, knees, shoulders, and elbows. Tender, warm, swollen joints. Joint stiffness that is usually worse in the mornings and after inactivity. Pain, swelling of the joints, decreased movement, pain that is worse with joint movement, bumps over the small joints, trouble grasping or pinching things. Trouble doing activities of daily living, such as tying shoes, opening jars, or buttoning shirts. Potential. Tiredness and lack of energy, fatigue, occasional fever, and loss of appetite. Causes. Genetic. The exact cause of RA is not known. There is evidence that autoimmune conditions run in families. For instance, certain genes that you are born with may make you more likely to get RA. HLA-R4. This is the gene that is most associated with RA. People who have this gene are most likely to develop RA than those who do not, and symptoms may be worse. STAT4. This particular gene regulates and activates the immune system. TRAF1 and C5. These genes play a major role in causing chronic inflammation. Causes. Environmental. A warmer, drier climate may be optimal. Lower temperatures may lead to thickening of synovial fluid, which lubricates the joints. This thickening could lead to joint pain and stiffening. Bones and connective tissues in the human bodies, like structures and homes, become smaller or larger in response to change in barometric pressure. Cadaver studies have shown that barometric pressure can influence pressure in the joints. Alternatively, stretches of cloudy or rainy days may lead to low mood, which may cause people to focus more on their pain. On cold, rainy days, patients may be less likely to be out and active. Lack of physical activity is known to worsen joint pain and stiffness. Causes. Lifestyle. Smoking is a known risk factor for causing RA. It also appears to be associated with greater disease severity. People who are overweight appear to be at somewhat higher risk of developing rheumatoid arthritis. Who is most likely to get RA? Age. Rheumatoid arthritis can occur at any age, but most commonly between the ages of 30 and 60 years. Sex. Females are more likely than males to develop rheumatoid arthritis. Ethnicity. In the U.S., specific populations have been identified with higher rates of RA, including the Pima and Papago Indians of the American Indian population, while it is traditionally reported that RA affects predominantly Caucasians. Countries and regions. The highest rates were observed in Russia, but it is seen in countries worldwide. Other diseases and disorders linked to RA. Osteoporosis. Rheumatoid arthritis itself, along with some of the medications used for treating rheumatoid arthritis, can increase your risk of osteoporosis, a condition that weakens your bones and makes them more prone to fracture. Rheumatoid nodules. These firm bumps of tissue most commonly form around pressure points, such as the elbows. However, these nodules can form anywhere in the body, including the heart and lungs. Dry eyes and mouth. People who have rheumatoid arthritis are much more likely to develop Sjogren's syndrome, a disorder that decreases the amount of moisture in the eyes and mouth. Infections. Rheumatoid arthritis itself, and many of the medications used to combat it, can impair the immune system, leading to increased infections. Protect yourself with vaccinations to prevent diseases such as influenza, pneumonia, shingles, and COVID-19. Abnormal body composition. The proportion of fat to lean mass is often higher in people who have rheumatoid arthritis, even in those who have a normal body mass index. Carpal tunnel syndrome. If rheumatoid arthritis affects your wrists, the inflammation can compress the nerve that serves most of your hands and fingers. Heart problems. Rheumatoid arthritis can increase your risk of hardened and blocked arteries, as well as inflammation of the sac that encloses your heart. Lung disease. People with rheumatoid arthritis have an increased risk of inflammation and scarring of the lung tissues, which can lead to progressive shortness of breath. Lymphoma. Rheumatoid arthritis increases the risk of lymphoma, a group of blood cancers that develop in the lymph system. Tests performed for a diagnosis. Blood tests. People with rheumatoid arthritis often have an elevated erythrocyte sedimentation rate, ESR, also known as a SED rate, or a C-reactive protein, CRP, level, which may indicate the presence of an inflammatory process in the body. Other common blood tests look for rheumatoid factors and anti-salicylic citrullinated peptide, anti-CCP, antibodies. Imaging tests. A doctor may recommend an X-ray to help track the progression of rheumatoid arthritis in joints over time. MRIs and ultrasound tests can also help a doctor judge the severity of the disease in the body. Prognosis and outlook. There is no cure for rheumatoid arthritis, but clinical studies indicate that remission of symptoms is more likely when treatment begins early with medications known as disease-modifying anti-rheumatic drugs, DMARDs. Treatment, medications. The types of medications recommended by a doctor will depend on the severity of the symptoms and how long someone has had rheumatoid arthritis. NSAIDs, non-steroidal anti-inflammatory drugs, can relieve pain and reduce inflammation. Over-the-counter NSAIDs include ibuprofen, Advil, Motrin IB, and others, and naproxen sodium, Aleve. Stronger NSAIDs are available by prescription. Side effects may include stomach irritation, heart problems, and kidney damage. Steroids. Corticosteroid medications such as prednisone reduce inflammation and pain and slow joint damage. Side effects may include thinning of bones, weight gain, and diabetes. Doctors often prescribe a corticosteroid to relieve symptoms quickly, with the goal of gradually tapering off the medication. Conventional DMARDs. These drugs can slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. Common DMARDs include methotrexate, Trexol, Atrexep, and others, leflunomide, Arava, hydrochloroquine, Plaquenil, and sulfasalazine, azulfonide. Side effects vary but may include liver damage and severe lung infections. Biologic agents, also known as biologic response modifiers. This newer class of DMARDs includes abatacept, Orencia, adalimumab, Humira, anakinra, Kineret, certolizumab, Cimera, Entrecept, Enbrel, glofitamab, Simponi, infliximab, Remicade, rituximab, Rituxan, certolizumab, Kevzara, and tocilizumab, etc. Biologic DMARDs are usually most effective when paired with a conventional DMARD, such as methotrexate. This type of drug also increases the risk of infections. Targeted synthetic DMARDs. Baricitinib, Olumiant, tofacitinib, Xeljanz, and upadacitinib, Rinvoq, may be used if conventional DMARDs and biologics haven't been effective. Higher doses of tofacitinib can increase the risk of blood clots in the lungs, serious heart-related events, and cancer. Treatment, clinical trials. There are many ongoing and developing clinical trials researching ways to help treat the symptoms of as well as cure RA. People with rheumatoid arthritis could soon benefit from a new drug treatment that not only suppresses inflammation, but also significantly reduces patient-reported pain scores. Otilimab is a monoclonal antibody biologic drug which targets and suppresses the inflammatory cytokine GM-CSF. Preventions, therapy. A doctor may refer someone to a physical or occupational therapist who can teach exercises to help keep joints flexible. The therapist may also suggest new ways to do daily tasks that will be easier on their joints. Assistive devices can make it easier to avoid stressing painful joints. For instance, a kitchen knife equipped with a hand grip helped protect finger and wrist joints. Certain tools, such as button hooks, can make it easier to get dressed. Preventions, surgery. If medications and therapy fail to prevent or slow joint damage, a doctor may consider surgery to repair damaged joints. Surgery may help restore the ability to use the affected joint. It can also reduce pain and improve function. Surgery carries a high risk of bleeding, infection, and pain. Rheumatoid arthritis surgery may involve one or more of the following procedures. Synovectomy, surgery to remove the inflamed lining of the joint. Synovium can help reduce pain and improve the joint's flexibility. Tendon repair. Inflammation and joint damage may cause tendons around your joint to loosen or rupture. Your surgeon may be able to repair the tendons around your joint. Joint fusion. Surgically fusing a joint may be recommended to stabilize or realign a joint and for pain relief when a joint replacement is not an option. Total joint replacement. During joint replacement surgery, your surgeon removes the damaged parts of your joint and inserts a prosthesis made of metal and plastic.
I was diagnosed in my early 30s after my third knee surgery that I had due to multiple sports injuries. I did not have a difficult time getting a diagnosis since my surgeon confirmed my diagnosis with a blood test to check my C-reactive protein levels, and those increase with high levels of inflammation in the body. Certain foods like red meat and processed foods will cause flare-ups. The weather changing also affects how I feel. Both will cause pain and swelling and stiffness. Advil or Aleve, type of non-steroidal anti-inflammatory drug, typically helps with the inflammation and swelling. Regular exercise also helps with maintaining strength and range of motion, but not resting also will make you feel worse if your joints are inflamed. I'm pretty fortunate because I have early onset rheumatoid arthritis, but I do have a close friend who also has the same diagnosis. She has had it since her early teen years, and she is not able to function for the most part with daily life. She's had to take several different medications, and the cost of those medications is insanely high. She is not able to be as mobile as she once was. Her daily life has changed over the last, I'd say, 5-10 years greatly. She's not able to work any longer. Some of the medications that she's been on has caused blindness, and so she's now visually impaired due to some of the treatments for RA, and she is no longer able to maintain her professional license. She's no longer to maintain her driver's license, so she's had to give up a lot in life.
Correlated diagrams. The image on the left, circled in red, has joints across the body where pain will occur with rheumatoid arthritis. The image on the right depicts the different effects across the body that rheumatoid arthritis will have other than just the pain afflicted on joints. The stages of rheumatoid arthritis. Stage 1, the body mistakenly attacks its own joint tissue. Stage 2, the body makes the antibodies and the joints start swelling up. Stage 3, the joints start becoming bent and deformed, the fingers become crooked, These misshapen joints can press on the nerves and can cause nerve pain as well. Stage 4. If not treated, the disease will progress to the last stage, in which there's no joint remaining at all, and the joint is essentially fused. Figure 1 on the left is an X-ray of a normal hand. Figure 2 on the right is an X-ray of a hand with rheumatoid arthritis. This next image shows you the thickening of the synovial membrane, the synovial fluid, and the degraded cartilage within the finger of someone with rheumatoid arthritis. This image shows another representation of RA within the joints. This diagram starts at the pre-arthritis phase and moves to the clinical phase, demonstrating the environmental factors, epigenetic modifications, and susceptibility genes. It moves through the altered post-transcriptional regulation, self-protein signaling, and the cell's loss of tolerance. Infectious triggers, microvasculature, transition to arthritis, as well as neuroimmune factors and biomechanics, also transition to arthritis. Within the clinical phase, this diagram shows synovitis, structural damage, as well as coexisting conditions that can happen after someone has transitioned with arthritis. This last diagram shows rheumatoid arthritis and different statistics around it. Over 54 million Americans are diagnosed with all forms of arthritis. 1.3 million of people in the US are diagnosed with RA. 3 times as many women are diagnosed as men. 60% is the risk of a heart attack 1 year after an RA diagnosis. 60% of people with inadequately treated RA can't work 10 years after onset. 25% of deaths in people with RA can be attributed to infections. Sources used for this presentation, as well as sources to access more information about RA, are the Mayo Clinic, Johns Hopkins Medicine, the National Institute of Health, the American College of Rheumatology, and the National Library of Medicine. Awareness and support organizations are the Arthritis Foundation and the Rheumatoid Arthritis Foundation. RA Awareness Day is February 2nd of every year.